Hi, my name is Dr. Michael Corey, and welcome to the Art of Peripheral Neuropathy Recovery. It's a place to share, to learn, and most importantly, to recover. What I'd like to do is not only introduce myself to you today, but I'd like to talk to you a little bit about the differences between conventional care, which you've all been under up to this point, and what we call functional healthcare. And functional healthcare, functional medicine, is the art of putting the problem areas back into a big puzzle piece so we can see exactly what's going on with you as a whole person. It's super important. Now, there's no doubt in my mind, because I've read all of your posts about how much you suffer. And I had a family member go through this, and I watched her suffer. And many of you are experiencing problems as far as with the burning, the numbness, the tingling, the loss of balance, the stabbing, the shooting pain, and it's just nonstop. And your doctors have given you gabapentin and Lyrica and Cymbalta, and you're on anti-anxiety medications. Well, what I want you to understand is that there's proof that nerves can regenerate. My buddy Russ Schroeder, and you might have seen Brant Larson do a video recently on gabapentin talking about this book. It's about cartilage and nerve regeneration. And that book shows that we've got over 90 pages of references, and there's 15 references on each page about how nerves can regenerate with different therapies. Now, is there an answer? Is there a hole-in-one for anybody with peripheral neuropathy? No, because your body is a multimodal system. And what this book will show is it shows that this will affect these cells, and this will affect these cells. And they're all references, so you have to pull the research off of each one that you're interested in. But I've gone and scoured this book. I've scoured many other books. And over the last 12 years of taking care of people with peripheral neuropathy, we have some commonalities that we have to look at. And we have to take care of those underlying conditions so that we can help you get well. Life is too short for us to be suffering on a day-to-day basis. The most important thing is to get your vitalistic self back so that you can take on the day and you can do it with vigor and accomplish the things that you want in life. And I know this might sound extreme for many of you that are caught in sitting in bed all day or sitting in a chair all day and not being able to get up on your feet and walk. But when you have that burning, tingling, numbness, loss of balance, you can't stand, you can't walk, you can't garden, you can't golf with your buddies anymore, you can't do the things that you love in life, it's time to make a change. And that's one of the most important things that I can reinforce with you today, is that you need to make a change. Doing the same thing over and over is the first sign of insanity, according to Albert Einstein. So what we want to do is we want to make a change. And I'm going to help you make that change as we go through, but I want to just go through some of these things that maybe you haven't seen unless you've seen some webinars or other videos I've done. We've got the different scales. This is a peripheral neuropathy progression. We've got those arteries and veins and nerve tissue coming back up to the top here. It's reaching up to the skin. We slowly see a degradation as we don't get fuel and activation back over to those cells. So if we don't have fuel and activation, and we have toxins and we have disturbances in there, whether it's chemical or we have structural problems that are not sending this nerve signal back up to the top, we're going to have a problem with those nerves communicating. As we see the degradation here, in diabetes-related situations, we'll see this drop back, and as we do this, the capillaries are going to start to not have oxygenation. We're not going to carry blood flow. We're not going to have circulation to go through and allow those nerves and those tissues to work properly. So we start having tissue destruction way back here. Now, it's been said that even people that have insulin resistance for 2 years, 6 months to 2 years, somewhere in there, depending on what research you look at, they can have this starting of peripheral neuropathy way before they're diabetic. So insulin resistance is something that we all have to be watching out for as well. But as those nerves start to regress farther and farther, and we see the capillary damage get more and more extent, then we're going to lose the sensation. You're going to get the numbness, the tingling, and the burning sensation in your feet, somewhere in between these three blocks. As we go and we progress even farther, we're going to start to have tissue die off. And when we have the sores start to come up, or we start to feel callus areas in the feet, it's super important because that skin should be nice and soft like a baby's butt. When we go back and we look at this sore and we progress, we've got injury to the tissues already, and then we come back over to this one here and we start to have gangrene. Gangrene is tissue death. And unfortunately, I have clients that have gone through this. They've lost toes. I have a client right now that's going through this, and she may even lose her foot. So I don't want any of this to ever happen to you. this is a progression. It doesn't happen just like that in 99% of the cases. Now, what we want to look at is we want to look at how can we heal. When we look at how we can heal, we have to understand that we've got different types of nerve fibers. And those different types of nerve fibers, talking about motor, that give you the ability to move, sensory, the ability for you to feel your environment, and then the autonomic, which is your auto-regulation, your heart, your lungs, your organ and tissues. We have to look at how are we going to affect those. So with the motor, we want to look at these large diameter fibers. This is what controls muscle function. They're myelinated. They have an outer wrapping, just like a wire that you plug in the wall. It's got insulation so that current can pass from point A to point B. We can go back and we're going to look at the large diameter fibers. That's going to control your muscle. We're going to also affect the ability for you to detect touch, which we don't find a huge change with people with the large fibers so much, especially with our small fiber neuropathies, because it's only affecting this area. And in that area, we're going to lose the ability to detect cold and hot. In addition, we're going to fire off those pain receptors again. Pain receptors are called nociceptive pathways. And when we look at the structure of your body, when we go back and we look at those nociceptive pathways, that sensation from your foot and gravity pushing down on the foot, sending signals up through receptors in your joints and your muscles, they all fire back up to an area called the cerebellum. That cerebellum in turn fires back over to the parietal cortex, which is where you feel the pain. But that cerebellum is important because when we continue having a pain cycle, then what happens is that cerebellum starts not getting the information. And as a consequence, because the cerebellum works with your accuracy, your balance, and coordination, you start to tumble over when your feet can't feel the floor anymore. So that's the reason why we lose our balance, is because you can't feel the floor anymore. You lose proprioception in that area. And what we want to do is we want to make sure that we back up the clock. So we have to ask why. Why is this happening? Well, we've got tissue destruction. We have to ask why. And I'm going to go over in detail on subsequent videos, each and every one of these aspects of how your body starts to break down and where it starts to break down. Today, what I want to do is we're going to talk to you about conventional care versus your functional care. Many of you have not been presented with what functional wellness is about, what functional medicine is about. So I've worked with not only functional endocrinology, functional orthopedics, and functional chiropractic. When we say function, it's about getting you back to function. So when we look at conventional medicine involves a system of diagnosis of conditions followed by an algorithmic approach to treatment with treatment of drugs and surgery. The first line of defense is always a medication. You know, how many of you have had your doctors tell you to change your diet, or if you have high cholesterol, they don't give you the cholesterol medications, the statins that cause peripheral neuropathy, that make your situation worse. They would instead take you as a line of cattle and give everybody their drug. So I'm not about that. What we want to do is we want to take Mother Nature's recipe. We've got fruit, vegetable, and fruit that God put on this earth, and we also have normal function that we were born with. So we lost that function as we've gotten older when we have these chronic conditions. And so we want to look at not an algorithmic pursuit, because Dr. Ted Levine, he's a medical doctor, he specializes also in peripheral neuropathy. He says despite the ever-growing number of blood tests, spinal taps, nerve biopsies, genetic tests, at least 50% of the neuropathies remain undiagnosed. We have no idea why it came about. Well, medicine doesn't approach you from a functional standpoint. Dr. Levine, he has done IVIG and all these other types of approaches that have helped a lot of other people. So we want to look beyond traditional care. Traditional care's approach to treatment remains primarily focused on the symptomatic relief and not the health of the individual or the tissues or the organs or the process itself. When we look at this happens with all chronic conditions, talking about diabetes, autoimmunity, thyroid conditions, methylation problems, medically induced toxicity with chemotherapy, environmental toxins, nutritional deficiencies. This is where our focus needs to be. Now, each and every one of these areas is involved with peripheral neuropathy. If you've got blood sugar problems, you can worsen your peripheral neuropathy. It can create the peripheral neuropathy. If you have autoimmunity, it can create the peripheral neuropathy. It can worsen the peripheral neuropathy. Thyroid conditions, long-standing thyroid problems have been documented to cause peripheral neuropathy. There's a lot of people out there that have thyroid problems, metabolic problems, getting metabolism back into the cells. And when they have metabolic problems for a long period of time, what happens is we start having destruction of nerves. Now, virtually 90% of people with hypothyroidism actually have a condition called Hashimoto's thyroiditis. And Hashimoto's thyroiditis is an autoimmune condition where your body starts attacking its own thyroid. So when we look at autoimmunity, we can look at lupus, where we start affecting soft tissues and connective tissue. We can look at rheumatoid arthritis, where it attacks the joints. So very often, many of you have multiple autoimmune conditions, and nobody's diagnosed it. They're taking the symptom approach and they're giving you medication, and we want to make sure that we can look at you and as an individual. These underlying issues alone leave many people with peripheral neuropathy suffering without improvement for year after year after year. I talked to a lady earlier this week, and she told me she had been diagnosed with insulin resistance, and that was about 7 years ago. Well, this past year she was diagnosed with diabetes. So we had a beginning. We could have had intervention at that point. We could have corrected the thought process and made some changes in her lifestyle to get her back to wellness and get her back to vitalistic health before allowing this to progress. Now, nobody can do it for you. You have to take the steps and you have to take action. You have to be able to say, okay, I don't like the road that I'm going down. I'm going to switch off this for that. And I'm going to talk to you a lot about switching off this for that, because a lot of these are choices. You have a choice where and what you're going to do from today on. We're all given 168 hours in each week to do what we want. And I want to help you along the way so that we can change the path of your future. Functional medicine is a science-based healthcare approach that assesses the underlying causes of illness and individually tailors a care plan for you. So we're not giving you just a one pill fits all. We're going to go through and we're going to look at you individually as we go through to see if and how you can be helped. It's also a science-based system of personalized healthcare that focuses on the root causes of chronic illness and the correction of the underlying causes of the problems. So when we look at functional medicine, we're going to look at the science-based part that connects the emerging science to the clinical practice. We use physiology, just like medicine, mechanisms, interactions, and case studies, but we take the information and we do something positive with it. We look at where people are having benefit, where are they not having benefit, and putting a big Band-Aid on with gabapentin or Lyrica is just simply that. It's just a Band-Aid. Pharmaceutical, placebo-controlled double-blind studies. You know, a lot of people will benefit just as much from a sugar pill when we do these studies, and numbers can be twisted around and so forth as far as with research, because who's paying for it? Big Pharma is. And if Big Pharma is paying for it, they want you to be a customer for life. And we want to make sure that we don't let that happen, because the more medications you're on, the more side effects. We're going to also look at genetics, and when we look at genetics, you have to understand that this is a biochemical individuality that you all implore. And if we have genetic problems like the MTHFR gene, for example, which regulates your ability to detox and metabolize properly, then we can have a problem with your ability to heal. Genetics is not your destiny. Just because you have a genetic predisposition doesn't mean that you have a genetic expression. You have to have some triggers to that to make that genetic expression expressed. So genes don't regulate how your future is going to be. They're a guideline. We want to take them into consideration, but it's not the tell-all be-all. We're going to also look at the environment, because the environment is what's going to affect and influence those genetics. Chemical, structural, epigenetic elements combine to influence the genetic expression, and manipulation of the genes is possible by changing the lifestyle, by changing the things that you're doing, by looking at the chemical reactions that cause different genes to be expressed. And through genetics, we look at what the precursors are, and do we need to step in before that action takes place from a biochemical standpoint. So it can get pretty heavy, and I'm going to talk to you all about this, and we're going to have other webinars regarding this, but I want you to be informed. Through your environment, regarding the environment, Willett, a researcher, says we have been able to identify modifiable behaviors or factors, including specific aspects of diet, weight loss, weight gain, inactivity, smoking. It accounts for 70% of the cardiovascular events of strokes and colon cancer, over 80% of chronic cardiac heart disease, and over 90% of adult onset diabetes. So, I would say diabetes type 2 is unfortunately the diabetes that you chose to have because of lifestyle. And sometimes it was out of your control. You weren't given choices. You weren't given a this for that. So we want to change that. I want to give you options. I want to show you a better way of life and how you can make sure that you can enhance the functions of every part of your body for the rest of your life. Now we have 7 principles of functional medicine. It's science-based, it's biochemically individual, and it's patient-centered care. Now we want to look at also that we look at a functional medical assessment, and we're looking at full wellness over here, and we're looking at illness here. We never go from point A to point B just overnight. Everything is a progression. We lose function over time, or things break down over time. So it's a web-like interconnections of physiological processes. I call it the web of physiological dysfunction. And when we look at these kinds of things, we see that people are completely healthy up on top, and as we start to have organ system failure, and we start to have some symptoms come about where we're given medication way down here, I like for people to be proactive. Get your blood test and know what's going on so you can be better educated. The wonderful thing about the internet is that you can have all the information. The hard part is employing a protocol that makes everything fit together and work. So when we go through and we look at functional medicine, we've got protocols intact that we know that we can keep that person up at an ideal, healthy state. Whereas otherwise, when we're just taking care of symptoms, you're going to just continue to decline. And as you decline, you're going to get more and more medications spread into these different areas. One for heart, maybe a heart condition, one for blood pressure, one for diabetes, one for pain. So you're on 4 or 5 different medications, all having different side effects. Now, this is a web of physiological dysfunction. And when we look at environmental inputs like your diet, your nutrition, your exercise, any past traumas you have, any immune or inflammatory problems causing an imbalance in the ability for your body to keep the good guys in front. When we go through and we look at your gastrointestinal imbalance, do you have leaky gut? Are you not able to assimilate nutrients through your digestive tract? It's all there. Structural imbalance. This is a little baby spine that I have, and when we look at babies, they go through and they grow, and the first thing to develop is the spinal cord called the notochord. So that little spinal cord, 2 cells come together, it creates a notochord, and that ends up being the communication system for your entire body. So do you think it's important for you to sit up straight? If your head's down here, you need to go through and pull it back up. Structure is important because your brain sends a signal all the way down that entire spine, all the way down to control every muscle, cell, and tissue of your body. Do you think that might be important? Has your doctor ever talked to you about spinal stability or the viability of how those nerves come out of the spine? Super, super important stuff, and we want to make sure that we don't ignore anything. The communication system structurally, neurologically, from an endocrine standpoint, energy production, oxidative stress will cause problems with your energy. And when we have bad lifestyle choices, we're going to get more oxidative stress. Detoxification and biotransformation. Your microbiome in your gut is virtually 70-80% of your immune system. So do you think it's important that we maybe check out the gut, look at your blood test, run some special tests possibly? And we're going to look at how hormones and your neurotransmitters will make a big, big difference for you as well. Like I said, from a hormonal standpoint, your pituitary fires back down, it releases luteinizing hormone, follicular stimulating hormone, your thyroid stimulating hormone, all that stuff coming together regulates how you feel on a day-to-day basis. This is a web of physiological dysfunction. And when we put the pieces together, this is a little piece over here that your doctor is looking at, this is a piece over here your doctor is looking at. All these are spread all over, but they're separated. Or you ever see the big picture? No. And that's why we're in the catastrophe with healthcare that we're in today. Nobody's putting the pieces together and look at the big picture. So we've got some lifestyle in the middle here. We've got the genetics. We've got the environment. This is what we call an iceberg analogy. When we look at the sea level here, this is what sank the Titanic, because that ship came in, it didn't see what was going on underneath, and your health is exactly the same way. We have all this going on a regular basis. If a lifestyle breaks down, or for some reason we have an expression due to toxins or something with our genetics, or our body's not getting the nutrients and genetically we get an expression, or if your environment is influencing you and you're not eating the right things, you're eating things that are causing more gas on the fire, and we never put out the inflammation. So we want to look at you from a standpoint of being able to take care of this. If you don't take care of this, and virtually so many people are not taking care of the underlying causes of what causes weight gain, obesity, constipation, diarrhea, heartburn, indigestion, depression, insomnia, memory loss. I was in a Mastering the Brain chemistry seminar 3 weeks ago, and it's just devastating to see when people start losing their brain. I want you to understand that that's also the nervous system. It's got to send a signal down to your feet. And if your gut's on fire, your brain's on fire. If you're inflamed here, you're inflamed in your brain. If your brain's inflamed, those nerves in your feet are never going to be working properly. So we want to look at high blood pressure, increased blood sugar, your headaches, systemic inflammation. That's a key word right there, is that systemic inflammation and these environmental triggers. So we want to make sure that we cover all bases and we look at this. And as you see, that puzzle is pretty big. Lots of pieces have to fit together. When you have those dysfunctions I just talked about with the blood sugar and all that other stuff, you can create gastrointestinal disease, autoimmune disease, musculoskeletal disease, mental illness, cancers, heart and lung disease, insulin resistance, diabetes, stroke, thyroid problems. The list goes on and on. We have to keep this back in order. Lifestyle, your genetics, your environment, and keep the symptoms at bay. Because like I said, the Titanic ran into this part. It didn't run into the mountain that it could see. And we want to make sure that we don't allow that to happen to you from this day on. There's things you can do on a day-to-day basis which will make tomorrow better than it was today. And so we're going to look at your health care in another dimension. Now, symptom care, your surgery and your medications, I'm going to keep that on that side of the table. There are emergency situations where you do need those things. In a lot of cases, in severe cases, you do need those things to cope. I'm the first one that's going to be at the ER if I have an emergency. But I'm going to go through and look at myself from a functional basis if I have a chronic disease. Because the acute care that medical doctors provide is not going to take care of you as a chronic condition patient. They're giving you acute care for a chronic problem. So when we look at functional medicine, we're going to treat the underlying causes, and we're going to let the doctors take care of the symptoms. And if you need symptomatic care temporarily until you get your body upregulated, and we can get you off the medication so your body can start to function as much on its own, then by all means, that's exactly where we want you to be. We want you to work on vitality and health, not system disease. So what I'd like to do is I'm going to talk about some core imbalances and dysfunction. And I mentioned earlier regarding hormones, your neurotransmitters, and your antioxidants from the food you take in, the supplements you take, mitochondrial function. Now that's the powerhouse of every individual cell, is that mitochondria. We want that mitochondria to be a little engine that brings in nutrients and excretes waste. And if we're not doing that because maybe your homocysteine levels are too high on your blood test, maybe we've lost circulation along the way because of a couple of genetic factors, then by all means we need to fix that. If your immune system is compromised, you're not going to heal as well. It's going to create more inflammation. And inflammation is going to cause more immune problems. It's a self-perpetuating cycle. If you have nutritional deficiencies, if you have detoxification problems, or structural functional problems, we want to make sure that we get to the core cause, and we identify those things so that we can do the best with you in each and every one of those categories so that you can start to increase your function. Now, I don't want to talk a bunch of scientific mumbo-jumbo, medical terminology stuff, but it's important for you to try to understand, and I'll always go through and try to explain things as much as possible. When we go through, what I always want to make sure that we start off with anybody is I need to know more about you. And that's what's so vital about the Facebook page, is because I want to hear from you, what you're experiencing. Put questions on there if you have questions. We want to go through and get medical and nutritional history, evaluate people with diagnosis of peripheral neuropathy. Maybe you had a punch biopsy, maybe you had a sensory testing. There's questionnaires that you can have that I'll post on our board that will show you And it's just a questionnaire. It'll talk about that. I also have a sensory test that we send out to clients, so you can check your progression as well with vibration, with joint position sense, with pinprick, with cold, with heat, and I'll show you how to do all of that. We have a body composition assessment. We want to look at each system, break it down, make sure that we can see where your problem areas are. And we're going to do diagnostic lab tests. Now, lab tests are unique in that your doctor does spot shots because he's treating symptoms. I recommend for people to have a global, a comprehensive panel with not only expanded thyroid panel, but also homocysteine, C-reactive protein, all of your immunoglobulins marked out. So these are important areas that we want to look at on a blood test that your doctor is normally not going to be looking at. And then we want to make sure that we focus on identifying underlying conditions and correcting each one of those. So that's more of a functional medicine approach, functional neurologic approach, functional endocrinology approach. We're going to do diagnostic tests with your urinalysis, your blood chemistry, your micronutrient testing. We might do hormone testing, stool analysis, toxin and heavy metal screening. You know, mercury will cause peripheral neuropathy. Thallium will cause peripheral neuropathy. Arsenic will cause peripheral neuropathy. So all these things need to just be checked out. Allergies and food sensitivities and oxidative stress and genetic methylation problems. So those are really the categories that we want to look at when we evaluate each person. Now, based on a patient's history, evaluation, assessments, and lab findings, we can customize a comprehensive care plan for you so that we can get to those underlying causes of the problems and we can get you well. So deciding to take action is the beginning of which healing begins. Now, what I want you to understand is it's all up to you. You have to take charge, because if you are sick and tired of the numbness, the burning, the shooting, the stabbing pain, you can't stand, you can't walk, you can't go for the jog that you used to, you can't golf, you can't garden. If your life is I can't, I want you to turn it into I can, because the changes occur here. You have to have a positive mental attitude no matter how bleak things are right now for you, because tomorrow can be a better day. And what I'm going to do is we're going to be doing a Facebook Lives on our page here just for you. So I'm not going to broadcast it everywhere. It's going to be just for our group. And what I want to do is cover those things that are vital for you to know. Now, we put protocols together, and I do have clients that I take care of online. But I'm not here to sell you anything. I want you to, first of all, share your information, learn more information, and learn how to recover. Now, there is an expense with things when we go through and we get equipment and when we do supplementations and all those kinds of things, because it does cost money to make a change sometimes. But there are things that you can do, such as stopping, don't eat any more gluten, become gluten-free. And I'll give you plenty of reasons why I want you to become gluten-free. Okay? The pesticides, herbicides, and not only that, is the wheat that we have now is not what the wheat that you had when your grandmother was around or your great-grandparents. It's not the same. Things have changed. And some food is not thy medicine. So I want your food to be your medicine, but I want you to make sure you eat the healthy nutrition stuff that you should. So once again, we got that web of physiological dysfunction. Okay, we can look at the brain is here. We can look at the lungs over here. We can look at your liver, your gallbladder. We can look at your adrenal glands. We can look at your kidney. We can look at, we can put this into a different dimension of looking at organs, and that's what I'm going to do with you in the future. We're going to talk about each one, how to help get those areas clear and healthy again so we can bring you better health. Now, I have a favorite quote that I have, and I have it up in my office on the wall. It says, "A doctor of the future will give no medicine, but will interest his patients in the care of his human frame, in proper diet, and in the cause and prevention of disease," by Thomas Edison over 100 years ago. Hippocrates has some great quotes as well. These people had the thought process, common sense, to go through and write this stuff down over 100 years ago. How come we haven't caught up? It's because of the capitalistic way that pharmaceutical companies and the healthcare system is. Hopefully this has been very, very entertaining for you. I'm not a very good dancer. I'm not a very good joker, but my heart is with you. And what I like to do is make sure that I can serve you. Because if I serve you and we change one life, we've changed a lot. We've changed a family's life. We've changed all their friends. We've changed a destiny. So take the steps, whatever is top of mind for you. What's one thing that you can change? I'd like you to post it underneath this video when I put this up. And I'd like you to post, what are you going to change today? Are you going to get up and make yourself exercise, even though it hurts a little bit? Are you going to change your diet, or are you going to do something? Put down a post underneath this video of what you're going to change. I care about each and every one of you. And once again, God bless all of you, and I'm here for you. So post your information. I'm going to do this on a regular basis. And I got a busy practice and taking myself off to do videos. It's something that I'm putting as a high priority because you are a high priority to me. Okay? Have a wonderful day. I hope you've enjoyed this presentation. Thanks. Bye-bye.